So this is the example of the pre-participation screening questionnaire from ACSM and the American Heart Association. It's hard to see the details here, but if you look at it in your book, the guidelines book, you can see all the individual questions. So, they talk about PCTA, angioplasty, but you want to be able to pick up these risk factors. So do refer to your book for more information. And let's look at the risk factors again. What does this tell us? Does a person need medical clearance? Do they need to talk to their physician? Do they need to get an exercise test? So that means GXT with Bruce protocol with ECG monitoring most likely. And does a person need to be, does their exercise test need to be supervised by a physician? Does their exercise program need to be supervised by a physician? So refer to the figures in your guidelines for exercise testing book. So we've covered these before. Once again, you're going to have to know these thresholds for the test, for any certification exam, whether it's AFA or ACE or ACSM. I'm not sure if NSCA goes as much into this, but definitely for the certifications, you have to know these numbers. You've got to know what they call the threshold, so the numbers associated with each risk factors. So remember, the risk factors are divided into positive risk factors. In this case, positive does not mean good. Positive means your risk is increased. Negative means your risk is decreased. So there are a bunch of positive risk factors, and there's only one negative risk factor, and that's your HDL cholesterol greater than equal to 60 milligrams per deciliter. So whatever we're going to do is we're going to sum up the positive, check to see if they have an HDL cholesterol greater than equal to 60, and then we get a total net amount of risk factors, and then that gives us our risk classification. So if you look at the numbers here, you've got to go age. Age greater than equal to 45 for men, 55 for women. Women get a little bit of time because of menopause till they go through menopause. And these numbers actually come from the Framingham Heart Study. So there are real data behind these numbers. They just don't come out of thin air. Family history, we've already covered this. So early heart attack, myocardial infarction, bypass surgery, angioplasty, or sudden death from heart disease in a first-degree male relative, so parent, sibling, child, before age 55 or before age 65 in female first-degree relative. Any cigarette smoking, they quit within 6 months, it hasn't been 6 months yet, or they have environmental exposure at work, at home. Sedentary lifestyle, not meeting physical activity guidelines for the past 3 months. So that's 5 days moderate, 3 days vigorous. Obesity, by waist circumference, by BMI. So either one of those, or if you have body composition values available to you. Hypertension, greater than equal to 140 over 90 millimeters of mercury. Either number could be high. It can be 120 over 90. It can be 150 over 70. Or they're taking medications. Same thing with dyslipidemia, high cholesterol. You've got to look at the whole package. Total cholesterol greater than equal to 200, or if they're taking medications, the average total cholesterol is high. Dyslipidemia, LDL cholesterol greater than equal to 130 milligrams per deciliter, or low HDL less than 40. We just covered diabetes, so impaired fasting glucose, so greater than 100 milligrams per deciliter, but less than 126, which is the cut point for diabetes. So we'll cover this on the next slide, but if the presence of a risk factor is not known, it should be counted, and there are some indicators on the next table.